All right, welcome to week 3 of Pelvic Health Essentials. This week, we are talking about self-management of common conditions, pelvic health conditions. So this is the session where I'm giving you those first steps of what you can do to start to turn around early symptoms or even symptoms you've had for a while, but maybe seem not that significant to you, but now you're realizing that they are a sign of something wrong, of what you can do before you may need more intensive care. Now, some of the things I go through, I think doing those things concurrently, reaching out for support professionally, and taking some of these first steps is really important. And I'll point those out to you. So today's objectives, basically, what is self-management? What does it look like? I chose this picture here. This is a little more business oriented, but it's really, what is that thought process that starts to happen when you notice something unusual or something different? Or if you've now, through this course, it's come into your awareness that, oh, you know what, that isn't normal and I've been ignoring it and I want to do something about it now. How to recognize common pelvic health conditions, tips for how to initially respond, and then when to seek out help from a professional, ideally a pelvic floor therapist, but of course, doctors, OBGYNs could point you in the right direction as well, or your gynecologist in some cases, colorectal doctors. There's a whole slew of specialists as well that could help. All right, so let's dive in. We're going to start with, okay, what is self-management? So self-management is like the essence of what occupational therapists do. When we work with our clients, we're often working with clients who have kind of prolonged symptoms or chronic conditions, but it's affecting their quality of life. So we're working to find things that they can do to better manage their symptoms and make them able to engage more in their day-to-day. So when it comes to pelvic floor, it doesn't really vary much from that, although hopefully if you catch a lot of pelvic floor conditions early on, you're not going to be experiencing any long-term problems. So there's strategies you can employ at the first signs that something is not quite right. And this is the process I'm going to take you through. So first, how do I identify it? How do I know? If you don't know something's wrong, you can't do anything about it. And then some thoughts and tips on how to establish a plan of action. How do you come back to that plan of action and assess whether or not it's doing well? This is a lot of times from here to here is where clients have trouble figuring it out. They're like, I tried this, but then I didn't know what to do and that didn't work. So hopefully today you're coming out with a few more ideas of, well, how could you come back and shift? And it's being a little bit more analytical about how you're going about what you're doing and to improve your symptoms. And then finally, hopefully there was success, but if you've done a slew of things or a handful of things and there's no success, what to do then? All right, so identification. So these are the,
Hillary,
yeah.
I don't see any slides if you're showing them. I just see your desktop.
Oh, well, good to know. Thank you. And I have to admit, Nora, okay, weird. Okay. Let me go back. Let me stop share and see. Hi, Nora. So I was just diving in, but apparently you can see my slides. So that's a problem. Yeah, and when I'm in there, I can't see the chat. Okay, let's try this again. Screen share. You're just on my desktop. Right. Is this the right? Yep. Okay. Are you seeing? Let me Let me know. Someone give me, because I can't see the chat when I'm in here. Can you see the slides now?
Yeah, I see them
Okay,
now.
great. Yay, we didn't get too deep. Thank you. Okay, so this was, I was talking about identify, plan, manage, and succeed. So identification, what is that? So there are some elements. Of course, you need to have the knowledge to know that something's not right. And sometimes moms may know that it's not normal to leak, or that's not a good example. Let me give a better example. They know it's not normal to feel to bulge when they're inhaling and exhaling. Like they know that coordination system, but they're not as in tune as they should be with their body to recognize that they're doing the wrong thing. So it's one to have knowledge, but you do have to put in some of that work of self-awareness that we were talking about last week, of really connecting to the normal state of your pelvic floor and pelvic health. Like, what is normal? How do I feel normal? And you might be wondering, well, how do I know I'm even at normal? I just think it's good to start where you're at right now and tuning in. And then having the motivation, like, oh, I know this is wrong. I'm aware of it. I can feel it in my body, but then initiating something. So a lot of people know something is wrong. They feel it, but they don't do anything about it. And that, I say, is just going to, the sooner you get treatment, the better, or the sooner you take action, the better. The problem's not as significant, it's not as ingrained, and it's easier to change. So really finding that motivation to, okay, I got to do that bladder diary now and not in 6 months. And then resources. We need resources all along. And I would put myself out there as a resource, especially through my ongoing, the Facebook group we have for this course, but also my ongoing Windward Maternal Wellness Facebook group. That is an open Facebook group where anyone can ask any questions related to pelvic floor, and I can direct them to good resources or answer questions. But just having places you can go to be like, am I right that this isn't normal? Is great. And doctors are good for that too. Okay, so once you know something's wrong, setting the plan. So today we're going to talk a lot about like some tools, finding that motivation to stick with the plan. I'm big on setting very realistic, measurable, we call them SMART goals. So specific, measurable, achievable, realistic, and there's a time oriented to it. So not, oh, I'm going to keep a bladder diary this week, but no, on Monday, Tuesday, Wednesday, when I wake up in the middle of the day and at the end of the day, I'm going to mark off in my bladder diary, in my bladder we'll be getting to that soon. So so it's much easier when you're that specific to see action happen. Monitoring. So when am I going to reflect on if this is actually working? So a good example of that is taking a fiber supplement like psyllium husk to get rid of constipation or reduce constipation, but you just keep taking it blindly and you're like, oh, I'm taking it and it's supposed to be working. And I'll ask moms like, okay, so how is it working? And they're like, I don't know, I'm just taking it. Well, then you're not monitoring. You didn't put in a plan to monitor, and you're not cycling back and reflecting on, is this working? So then you're kind of may not be helping anything. Again, resources and accountability is great. So when you're planning what you're going to do for action, I think it's great to tell someone, or in some way like partners are great for that. Just like, hey, can you ask me each night if I actually took my psyllium husk today? I keep on forgetting, and that can help you be better with carrying out the plan. So then management. So this is that coming back and reflecting on, how am I doing? So setting that up in the plan, but then coming back and actually doing it. So I'm going to suggest a few different logs today, or journals. And you can do the journal, but if you don't look back and kind of reflect on what you wrote down, it's kind of a waste of time. That is a place where I help a lot of clients, like diving in, okay, what are we finding out from this? And it's certainly something a pelvic floor therapist could help you with. But in a lot of cases, I'm like, I think most moms could do this themselves to some degree. So you're able to self-reflect, and I'll offer today some questions that are good to ask. And then if you're recognizing that, this psyllium husk seems not to be working, what am I going to do now? That you shift and try something new, and you may decide to keep going with the psyllium husk because you're like, I think it's working. I'm going to the bathroom a little more often, but it's still really hard to pass. So you add something else on top of it, and then set a time to reflect on how that's working. So being as analytical and as intentional as you can is going to bring better outcomes. So logs and journals and tracking is going to be helpful in making these things actually help. Support is huge, and that's where, in resources, this where having someone to give you some, that didn't work, have you tried this, some other ideas. Always reaching out to professionals around you or others who may have some knowledge in that area. And then success. So what is success? Sometimes I'm like, I don't even know if I have improved. Well, decreasing symptoms is success because over time, it's likely that that symptom will eventually go away. Pelvic floor things are not quick to respond. They take time. And a lot of times it can take months to really see some progress, but that's where those logs are helpful because you start to notice like, oh, there is a little bit of change going on, even though I don't remember it, but I can see it in this log. Being consistent. This is a word I'm using all the time, is we just have to be consistent with things, and that's going to bring more success, and it's also going to maintain success. So things like a prolapse, you may reduce the symptoms of the prolapse, or you may reduce the grade of the prolapse. But if you lose your consistency in doing what brought you there, you're going to be right back at the beginning again. It is a management type thing. A long-term plan. So a long-term plan is, am I going to, in that prolapse example, a lot of times you have to do those maybe 4 or 5 things just forever to keep the prolapse from getting worse again, or the symptoms from getting worse. But in other cases, like a psyllium husk, which is a fiber supplement, the long-term plan could be like, I'm going to be doing these other even more natural things: hydration, movement, diet, more fruits and vegetables, to try to manage my constipation that way, and slowly grade off of psyllium husk or Dulcolax or whatever it might be that you're managing your constipation with. So what is that long-term plan? A contingency plan is, what am I going to do if I really get off track? So you're doing really well, but life can kind of give us these broadside us with certain things that knocks us off of this good track. And when you're doing well is the best time to make those contingency plans. So if I get really sick, let's use the constipation example. I get really sick, or I get food poisoning and I have diarrhea. Like, not going to need my fiber supplements for a period of time. But then do you forget to even start them again? And so the constipation returns. You have already set out intentionally or written down a contingency plan. Okay, so when the diarrhea passes, and what threshold would that be? 24, 48 hours later, I will start up my psyllium husk again, or my Dulcolax, or whatever it is, the calm supplement. And what that might look like is, the goal around that might be, okay, when diarrhea subsides or goes away, I'm going to set a reminder to start my psyllium husk 2 days later. Okay, so that's like a contingency plan. And that's really important to support success, because life throws us for loops. And then a good resources, always important. Okay, so let's dive into incontinence. This is a quick review from week 1, but identifying it, really, I'm going to focus on urinary incontinence today, but it's any leaking, dribbling, or otherwise involuntary letting go of urine, stool, or gas. A lot of the things with urinary incontinence will also improve gas incontinence. Stool incontinence is a whole different area that I'm not going to go into in this course, but and requires a little bit more specialization in some ways and more individual approaches. But urinary incontinence, there's two types. So the stress is more I'm running, I'm sneezing. When I go to stand up, when there's any effort or force, that's when you leak. Whereas urge is more linked to certain events, walking to the bathroom, public speaking, turning on water, something like that. So you've identified that this is occurring. My suggestion as a first step is a bladder diary. You don't want this to happen. Let's see how often it's happening, when it's happening, what's your hydration levels. So you maintain a diary for 3 days, and I will post this in the Facebook group. The diary that I recommend filling out, I'll post a PDF of it that you could just print out, save and print out if you ever need it. You're going to do it on non-consecutive days. It doesn't need to be 3 days in a row. It's whatever works for you, but usually across the course of 1 week. And you're logging for 24 hours, so including nighttime voids, what time it was, how long. So when you sit to go to the bathroom, you're counting or using a timer, 1 Mississippi, 2 Mississippi, and what number do you get up to? The time of any leaks, what time did they occur, and the amount, small, medium, large, that's just your estimate of it. There's not any like scientific way to determine small, medium, or large, just in your view. I view a small leak as just like a few drops. Medium would be like you need to change your underwear, and large is like complete loss of your bladder, like there's liquid on the floor. And your fluid intake is really important to log as well. So after the 3 days, look over the patterns. How many times did you go pee? How long are you voiding? And you're comparing this to norms that I'm going to go through in the next slide. Where are the leaks in relation to your voids? Are they right before? Are they shortly after? Are they when you haven't gone for many hours? Are they with activity? So that could be another column, what kind of activity you were doing. How much hydration did you have each day? How many ounces did you drink? So what doesn't fall into that, what I'm saying is normal range. That's where you start to shift or nudge your behavior in the right direction. So maybe I'm going to tell you on the next slide that you should be voiding about 6 times a day, but maybe you find that you're only voiding twice a day, that you're having leaks. So in my view, I would be like, well, you're probably filling your bladder too full so that then when you sneeze, it can't hold on. There's too much in there. So you need to be taking more time to go to the bathroom and taking that time for yourself. This is a pattern I've seen with some postpartum moms is they're just so busy taking care of baby that they're actually not going to the bathroom. And as soon as they start more intentionally timing, okay, it's been 4 hours, I need to go sit on the toilet, their leaks will decrease. So just looking at what's out of the normal range and picking one thing, just one, to try to nudge yourself towards. So let's talk about what's normal. Urinating 5 to 7 times a day in 24 hours. So in childbearing years, you should not be urinating at night. And during the day, if you're well hydrated, you should be urinating about every 3 to 4 hours. It could be a little more, it shouldn't be much less than 3. When you go, you should be having a steady stream for 10 to 16 seconds. And if you measure urine output, it's usually about an ounce a second. So if you're urinating for 16 seconds with a good steady stream, you can assume that you had a nice full bladder. And that is like, I'll give you a thumbs up, like that's good. Now, if you're only urinating for 5 seconds, you're not waiting for your bladder to get completely full. And I guess I'll bring it up now. The bladder is a very bossy organ. It will try to take over and be the boss, whereas your brain should be the one dictating what is happening. So by treating your bladder to being able to release urine when it's only a third full is telling your bladder, hey, you never have to feel that full. It's fine. I'll let you go whenever you first say you need to. And so then you're kind of becoming a slave of your bladder. So you want to, those urges are, and especially those first urges, really should be treated as just suggestions or like, hey, you know what, when you have a chance, I gotta go, rather than like, red alert, you gotta go right now. Urine passes easily. So when you sit down, once you like take a deep breath and relax for a moment, it just flows out. You don't have to do anything to make it come out. There's no straining, effort, force. So that trying to fast pee is not a good habit. Stopping your urine flow to test your Kegel strength is absolutely not recommended. It messes with the whole loops. I'm not going to get that technical. I'm just going to let you know, don't do it. A one-off test one time in postpartum, fine. But once you've done it once, you know that you can sort of, or that you can't stop your flow of urine, there's no need to do that test again. A lot of women will check that like every week. And I say, no, because what's happening is your bladder muscle, the detrusor muscle, is contracting to squeeze the pee out. And you have your two pelvic floor muscles that are holding the urethra closed. So at relaxed state, they're contracting, the pelvic floor muscles, and the bladder muscle is relaxed. Now you sit down on the toilet and your brain says, okay, bladder, you can release. So it contracts and these release. Now, if you test your pelvic floor muscles, you're contracting them. So you're telling your pelvic floor to do the opposite thing that it should be doing when you're passing urine, which is why that test Kegel peeing is not a good habit. Okay, I'll get off that soapbox. Bladder sensations can be delayed. So this goes back to that bossy bladder syndrome. When you feel your bladder, you can delay urinating until it's convenient. That is a normal functioning urinary system. If you feel that bladder and you're like, oh my God, I need a bathroom right now, and it hasn't been 4 hours, you have a bossy bladder and you need to start hushing it down. And we'll go into that a little bit more. So first steps to reducing incontinence, hydration. So a dehydrated bladder is more spastic and will send more frequent signals to the brain to void. So your bladder's like, there's not enough in me, I need more. And it starts to kind of get more sensitive. And that sensitivity, it's not that your detrusor muscle is doing anything, but that sensitivity feels like urges to pee. But then when you go, you're only voiding for maybe less than 10 seconds. Try hydrating better. So the rule of thumb, I think I've mentioned it already, but it's half your weight in ounces, half your current weight in ounces per day. And then next step, so if you are well hydrated, I would then suggest, okay, look at your diet, look at what you're eating and drinking, and I'll post a bladder irritant list in the Facebook group. But some common ones, of course, caffeine, citrus, dairy is actually an irritant, pineapple, even vitamin B complex can be an irritant. So some moms I've worked with are like, I'm not letting go of my coffee. I didn't have coffee for 9 months pregnant, and now in postpartum, I'm having my cup of coffee. That's fine, but maybe you could look at the rest of the list and kind of eliminate most of those, so you're not having as many irritants in your day. Breathe slow. Breathe and slow down, and also breathe slow. But this goes back to that bossy bladder syndrome. It's a reminder, it's a nudge from your bladder. It's not an alert. And your brain should be the one deciding when you're going to go consciously. Like, okay, I'm going to go to the bathroom now. And to proceed, so this goes ties more in with moms who have more urge incontinence is to proceed slowly. So you get that urge and you're like, man, I went to the bathroom an hour ago. What the heck? I say, okay, take a deep breath. Try not to get into that, oh my God, this is so upsetting to me brain. And instead flip to that calmer side. Take a deep breath, sit down, do a few Kegels. If it still comes back a few minutes later, walk, don't run. You see a toy on the way, pick it up, and just slowly proceed to the bathroom instead of this, I have to go. That behavior kind of encourages that pattern. And then pelvic bracing. So a pelvic brace is when, and I meant to edit this, it's when I do a pelvic floor evaluation or screening, I always do a neck test, and that's just your ability to Kegel and hold a Kegel when you cough or sneeze. So we ask the client to cough, and we're watching to see what happens in the perineum and the pelvic floor. Like, does it bulge out or does it hold tight? Hopefully it holds tight. But I think it's better for clients to view it as a pelvic brace. So pelvic brace is when you're engaging your transverse abdominis. You're trying to pull your hip bones together. This is a card in that postpartum self-care deck. And then you're doing a Kegel, or you're engaging your pelvic floor up and you're holding through the sneeze. You engage your deep core and you hold up your pelvic floor and you sneeze and you keep holding because you're probably going to sneeze a few more times. Sneeze, sneeze. Okay, I think the sneezes are past. Now I'm going to take a nice big breath and make sure I relax again. The problem with pelvic bracing is sometimes women forget the relaxing. And so now they're walking around always pelvic bracing. And over time, if you're always contracting a muscle, that'd be like you walking around all day like this. Well, after weeks and weeks of doing this, my bicep is going to be almost not functional. It's going to be so tight. So we need to relax as well. That's part of it. So I need to edit that a little bit. Okay, keep going. So tips by type of incontinence. So stress incontinence really is starting to do some Kegels. And like I said, went over last time, if there's any symptoms, stop if any symptoms increase. So if you feel like, oh my God, I started doing Kegels and now I'm having more leaking, that would be my first, would be like, okay, stop doing that. Let's do some more deep core strengthening is my tip. Everyone's different. There's so many dynamics with pelvic floor that there could be a lot of reasons that the symptoms increase. And that may be an indication, okay, I'm having some stress incontinence. I kept my bladder diary. And now I started doing Kegels and my symptoms are getting worse. That's kind of like a stopping point where I would say reach out for some support. You may need a pelvic floor assessment to kind of see why that's occurring. But if not, what would you do for Kegels? This is the start. So 1 times 10 reps, 2-second holds, then relax. So you hold 1, 2, relax. Hold 1, 2, relax. And then you do 1 set of 10 reps where it's a longer 10-second hold. And you start that laying down. So you're out of gravity. Easier to Kegel and contract muscles when they're working with gravity instead of against gravity. So then you would, after a week of doing that, you would do the same thing in sitting, a week of that, and then the same thing in standing. And you usually start to notice a lot more strength so that, okay, now I know I'm about to lift up my baby. So before I lift up my baby, I pelvic brace, but that Kegel component of it is a lot stronger now and more coordinated because you're in standing. And can hold better, so no urine leaks out. Strengthening the TA, and then learning the pelvic brace. We're going to go over more in week 5. I explained that briefly, but we'll keep talking about pelvic bracing. So urge incontinence. This is more a brain bladder issue. It's more of like that bossy bladder has kind of taken over, or these associations are really strong. and we need to start to unwind that association. And so what I mean by association is like on your way home from work, you're fine, you have no urge to go to the bathroom. As soon as you put your key in the door, you're leaking. And there usually is a lot of anxiety around this. Like, you know what's going to happen and you get really frustrated. And so understanding like, hey, my bladder is kind of being super bossy right now, and relaxation techniques are really helpful for urge incontinence. And I always suggest, like, I want you to talk to your bladder, like coach it. Like, you don't need to release right now. You can hold, we're almost inside. I'm going to walk right to the bathroom. But no, right now you need to hold. And like literally having these insane conversations with your bladder in your mind. And I say that from experience, because that once I learned that trick, that was the thing that really worked for me. My trigger would be being in places where there was no bathroom or no known bathroom. So like the playground. I'm like, oh my God, I have to go, but there's going to be no place to go if we're here. And so then my bladder would be like, ha, 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 ha. And I would have to go. And I would just freak out. And that freak out doesn't help. It's starting, okay, calm. So I would sit down, I do a few Kegels, take a few deep breaths, and the urge would totally go away. And the more success I had, the easier it became. But there's also, you can do that same Kegel sequence in the exact same way I explained for stress incontinence. The other strategy with urge incontinence is to slowly increase time between voids. So each week, so say you're voiding every 2 hours, you start to try to void every 2.5 hours using some of these. Mostly we're using relaxation strategies to delay. And hydration is another key factor. Okay, you keep going, I gotta keep track of my time. All right, so things that won't help incontinence is, second, I just wanna, yeah, okay. Limiting fluid intake. So a lot of times moms will be like, oh, I know I have to go out. We got to go to the pediatrician. My hands are going to be full. I'm not going to be able to use the bathroom, or I don't want to use the public bathroom. So they don't drink anything for a couple hours before they go out. But then they super hydrate when they get home. So like, oh, I am drinking half my weight in ounces of hydrating liquid a day, but they're like compressing it in 4 hours. And I'm like, no, I really need to be doing it throughout the day and not altering your behavior to avoid leaking. Hovering over the toilet kind of is similar to doing the stopping pee test, the Kegel test. You're to hover, to be in that position, your pelvic floor muscles are not completely relaxed. So then you're demanding your body to release urine when those muscles are not completely relaxed. And so that can create a hypertonic pelvic floor, which can create pain. So hypertonic meaning a tight pelvic floor. No just in case voiding. So this is, I'm about to leave the house for a few hours to go to the pediatrician, and I'm going to pee right now, even though I don't actually have to go. That starts giving your bladder the permission to be bossy, and is also just not a good habit for bladder health. So if you have not gone for 3 hours and you don't have the urge, you shouldn't go right before you go out. Focusing on reducing nighttime voids before daytime. So I have sometimes seen this where moms are like, oh, I'm not supposed to be going to the bathroom at night, but I'm going like 3 times. So they try to eliminate that first. The reason I don't recommend this is across the board, I've seen when moms regulate their daytime pees, their nighttime fixes itself. And you don't want to be causing a lot of anxiety and worry about peeing too much at night, because it can disrupt sleep. And sleep for moms is of utmost importance. So don't worry if you are going at night. Instead, address the daytime pee. So maybe you're seeing that, oh, wow, I'm peeing like 14 times a day. I want to get that number down. Start with the daytime, trying to increase the time between each pee. Worrying about every leak, it's progress. It's messy. It's not always like you might have a week where you don't leak at all, and then you have a week where you leak every day. It's just, are you being consistent with trying these strategies and give it time, be consistent, and try to stay calm as much as possible about it. Not talking to your bladder, they mentioned that one already. That's particularly for urge incontinence, and not learning how to pelvic brace. That's really key for the stress incontinence. All right, chronic constipation. So I already gave this definition, but it is, I view it as constipation that's not resolved within 1 week postpartum or passing stool less than 3 times a week for more than a month. And the reason behind this, again, is it adds pressure to the pelvic floor. Chronic constipation in and of itself is not always a pelvic floor issue, but it's very closely linked and can cause pelvic floor specific problems. And it increases intra-abdominal pressure. So the big risk with chronic constipation is prolapse. That's the primary concern. Okay, so what goes in matters. It's the first approach for resolving constipation. Again, hydration. Water is fantastic, but actually some other liquids are sometimes absorbed better for hydration purposes, like milk and juices. Electrolytes are great. And then if you're someone that just struggles with getting enough hydration in, foods that are high in water. I listed some there. Okay, diet high in fiber. So I always say start with hydration, then look at diet, and then go to supplements. Fruit with skin, apples, berries, pears, oranges, any vegetables, and lots of them. I prefer cooked. I think cooked is more easy on the digestion and still has just as much fiber. For breastfeeding moms, raw vegetables can be hard on baby and cause more gas issues in you and your child. And then grains and legumes, fantastic. Okay, so supplements. These are our more natural ones. A lot of times moms are sent home from the hospital with like Dupalax or some other laxative type things. And I say, okay, use that if you need that in that first week to not be constipated, great. But that's something that you want to try getting off of as quick as you can. And instead you might be working more backwards using supplements, working on improving your diet and working on hydration. So all these things at the same time. The magnesium, the brand, the line of products, Calm is great. It's actually more for stress, but magnesium helps us go as well. Psyllium husk powder, I'm not a fan of the capsules. I think powder is much better. And liquid chlorophyll, though you might be hard pressed to find any because there's been quite an uptick in popularity here for its skin benefits. But liquid chlorophyll has been used for decades by midwives to reduce constipation. So start slow with those and build up really slowly each week in terms of dosage. But that's where you need to monitor. Okay, 1 week, I'm going to do a half a teaspoon of liquid chlorophyll each day. Monitor, is it working? It's not really working. It's not getting me to where I'm going more than 3 times a week, or it's still really hard to pass the stool. It's not the right texture. Okay, increase by another half a teaspoon. Don't go one day, half a teaspoon didn't work. Okay, tomorrow I'm going to do 2 tablespoons. Like, ooh, no. Give your body time to adjust and adapt to what you're doing. Belly massage. So this is kind of a visual. This is in that postpartum self-care deck. I don't have the greatest shorts on today to show this. So let me just describe it with a picture. Didn't think about that. But you start, so your descending colon is over here. This is your left hip. That's where the poop ends, the stool ends, and it's going to come down into the rectum and anus. So you want to start over here, and you're actually going to start with the red lines, and you're stroking only one direction towards your belly button. So you're not going back and forth. You're just stroking in the direction of the arrow. So you go 3 to 10 strokes here, and you work clockwise. 3 to 10, 3 to 10, 3 to 10. You're laying down, you're breathing deeply. Okay, you made it around the clock, and now you do this square. So 3, 5, 10 strokes, left to right hip up to right ribs to left ribs, and left ribs down to left hip. All right, so really good. It's a good thing to do, like, you know, you're constipated. This is great in the early days postpartum, or if you have recurring constipation, to just do this as part of a morning routine. I wake up and I just kind of start doing this massage on my belly before I even get out of bed. Routines are great. We should be passing stool on more of a routine pattern, like a time of day where you typically pass stool is a sign of good gut health. If you're all over the map in terms of time, that's a sign that things aren't running consistently and smoothly. So movement, of course, helps the gut. I mean, I think anyone who has exercised knows that often after you go for a good run, when you come home, it's easier to go to the bathroom. So daily walks or movement routines as it feels good for you in postpartum. Slow down, deep breaths, relax the sphincter. So our rest and digest, our parasympathetic nervous system is what needs to be activated to go past stool and open your bowels. If you're in fight and flight, your body's going to hold it in. It doesn't have time for that. It's in survival mode. And when you're in survival mode, you do not need to pass stool. So we need to encourage that. That's where massage and deep breaths and taking your time can encourage that relaxation system that will actually allows your sphincters to open more. So moms who are trying to run in and go really fast, you're not going, you're causing more pressure, and it's not helping the problem. It's probably exacerbating it. So a lot of moms, I'm like, you need to tell your partner, whoever you have around, help, like, schedule in. This is mom's potty time. I go in the bathroom for 15 minutes and no one talks to me. It can be that important. Squatty potty is good. In this picture, I'm actually not doing exactly the right. I should have my knees in narrower and my feet should be wider. So your feet should be wider than your knees. That opens your hips and your anus and opens your sphincters better. And then instant timer. So this is something I've used with a couple of moms. I've told them, okay, go in the bathroom and I want you to bring your phone and I want you to turn on Insight Timer. Is a relaxation meditation app. And they actually have, I looked it up with my last suggestion with this client was maybe there's a relaxation that focuses on constipation. And sure enough, there was. And it's still on there. So if you just search constipation or gut, there's a lot on that gut-brain connection. It can be helpful, or just turn on something that helps you feel more relaxed. Okay, this is fuzzy. I will, it's a PDF and Canva doesn't like PDFs. So I will post it in the Facebook group. But this is how you determine, okay, how is my stool? So you maybe are going for, you've gotten your frequency up to like 4 or 5 times a week, where you're only going like twice a week before. But you're still having this type 1 is very constipated, and then this is diarrhea. So ideally, you're more ranging between type 3, 4, or 5, 4 being the most ideal. And it's commonly used with doctors will use this chart to help describe stool. So bowel tracking. So you've tried some things and you're just like, I don't know, I feel like I'm always constipated. I think it's a good idea to track it, like I was saying at the beginning. So maintain it. You do need to maintain this for 7 days because we don't open our bowels as frequently as we urinate. So to see some patterns and rhythms, you do need to track for more days, especially if you're constipated. Like you may only have 1, 2, 3 episodes to even go off of to look for patterns. So again, it's 24 hours, mark the time that you went, the consistency, that's the Bristol stool chart, the effort, how much effort? So a 0, you should be a 0. There should be no effort to pass stool. At 10, I hope no one's ever at a 10. 10 would be like, you're screaming, like it should never happen. Basically, a 1 or a 2 in my mind effort was like it took more time. Like I really had to sit there and relax and do. And I really have to make sure my diet's good. So that's more effort. It may not be effort in the bathroom, but what you're doing in the 24 hours is effortful. Like you have to remember. And then once you get up to like 4 or 5, that's like in the bathroom, it was still hard to pass. Hydration, food intake, and your treatments. What are you doing to try to help it? And so you can track, like, oh, on the day where I did everything right was the day it was a good consistency and it was easy to pass. Okay, there's a pattern. Stick with it now. So you're looking back, these are the questions you would be asking yourself. Or some examples. All right, prolapse. So identification. At the bottom, notice here, asymptomatic. There are lots of women pregnant, never have babies, young, old, who have a prolapse and don't know it. My thought on that is I think every postpartum woman should be screened for a prolapse. And if it is asymptomatic, like she's like, I feel fine, I don't have any of these symptoms, I still think she should be nudged to monitoring how she uses her pressure system, managing constipation. Should receive some education on how to ensure that that prolapse that she doesn't feel never becomes one that she does feel or that is more severe. So the symptoms are, well, the number one symptom is, and this you would have to use a mirror to see, so vaginal bulging is not your organs coming out of you. I mentioned that in session 1, but rather you have your vaginal canal and say it's your bladder up front. So what you might notice, I'm gonna not have my hand here, is on the front wall, you're seeing, and then the back wall's here. So you're seeing like the front wall of your vaginal wall come down, and it looks like this rounding bulging. And it freaks moms out or women out when they see it. They're like, what is that? Is that an organ coming out of me? And it is not. What it is you're seeing your vaginal wall, instead of being lifted up and in the shape it should be, it's being pushed down, usually by either the bladder or the rectum. But it's nothing coming out of you. Okay, so a lot of times women don't even know that that's there. They don't use a mirror to look down there, and that's fine. But more common symptoms are pelvic pressure, a backache that does not improve and is not explained, like you can't figure out why, bleeding, discharge, frequent infections, needing to splint. This is usually with a rectocele, a rectal prolapse, to pass stool. If it's bulging down you push on the perineum, it kind of straightens it out, and then stool will pass. So women who are doing that sometimes don't even know that they're just like, wow, that's the only way I feel constipated, and the only way I can get it to pass is if I push on my perineum and then it comes out. And then they come to learn, oh, it's because it's a prolapse. You're pushing that prolapse back into place. And some women stumble upon that technique by chance. Symptoms are less when laying down. That's a big indicator. As soon as you lay down and take that pressure, that gravity pressure off of your pelvic floor, your symptoms improve or disappear. Symptoms increase when you're straining. So these are some common quotes I've heard, or actually the quotes I've heard from clients that have prolapse. So I feel heaviness, more constipation since giving birth. Back is always aching. I feel like something's falling out. Like I feel like I have a tampon in there that's coming out, but I don't. And I'm just perplexed by it. It's actually not typically painful in of itself. So, all right. The key thing here is lifestyle modifications and what you can do. So if you're starting to have any of those symptoms, one, what I suggest is reaching out to a pelvic floor therapist, but also looking at how is my posture, ability to maintain that neutral hip alignment. If your hips are neutral, the pressures are more even and may help like your bladder be in better position. Whereas when you when you rotate your hips, posterior tilt, your bladder is kind of falling off that front ledge of your hip bone, and it's going to push more on your vaginal wall, whereas your neutral is going to stay more where it's supposed to be. So posture can have a big impact. How you're managing your intra-abdominal pressure, all that stuff from last week, constipation management is so important. It reduces the pressure. If you're not having constipation, you're not going to have as much intra-abdominal pressure, and you're not going to be having that added weight down in your pelvic floor. Proper lifting techniques. So using your pelvic floor, abdominals, and back muscles for lifting. This goes to like lifting that Amazon box off your front step, to lifting your baby, to lifting the stroller in the car. Are you pelvic bracing appropriately with a neutral hip alignment? It gets kind of complicated, but I think some women may really need coaching and therapy to support them in getting these lifestyle modifications. If you're someone who's pretty body aware and have done a lot of movement and feel very in tune with where you are in space, I think a lot of this you could piece together on your own, maybe with just a little support here and there. So the lifting example is you would need to pelvic brace. So you're lifting your pelvic floor, hopefully getting that organ back in place, holding in with your strong, deep core TA muscle. And then you're doing the right technique, ergonomics. We're going to go into that next week. And you're coordinating that with a neutral pelvis. So it's complicated. Not a lot of women can piece that all together on their own, but it's not impossible. And now that you know, I'm hoping you could try it out, test it out. And that's where I invite you to post pictures or post a video of you trying, and I could give you feedback. Pelvic rest every day. This is the one thing that any mom can do, is as soon as you get the symptom, as soon thereafter, you lay down. Even 1 or 2 minutes can make a difference. Just helps that pelvis be out of, so gravity is pushing those organs down, pushing. Okay, you go out of gravity, but you don't get that pushing anymore. And things can just kind of rest and go back into place. Being aware and responsive to symptoms. So when you get that symptom, you try to rest as soon as possible and you don't push through. So I always a little bit cringe when I hear early postpartum moms going on hikes. It's like their first exercise outing because it's such an uncontrollable environment. And I'm like, ooh, like if you get a symptom, what are you going to do? Like halfway up a mountain, like you can't really lay down too many places. So just keep, especially in that first 3 months, keeping yourself in a place where you can respond to your body's needs and signals in a timely fashion, especially if you're suspecting that you might have a prolapse. Okay, exercise is the other thing. Transitioning from doing things very much in standing or sitting to more laying down. So this is an example of this, there could be a myriad of exercises they're doing right here, but it's demonstrating like the pelvic floor is not getting gravity pushing down on it. So they could be working adductor strength, or they could just be working deep core to hold their legs up here while doing Kegels. And so kind of lifting and holding, lifting, pelvic bracing in this position, and then working subtle adductors. I am a fan of Pilates. I think it can be really great. A lot of that is in gravity eliminated position. Reformer classes are great as well. If you know how to manage your pressure system, if you know how to engage and lift that pelvic floor and pelvic brace as needed. So it takes some coordination. Yeah, I think I'm going to keep going on. We're going to get more into exercise in week 5. So I'm going to keep going for time's sake. Diastasis rectus abdominis, DRA. So I'll post this video on how to self-screen. It's about a 5-minute video that I did for another course on how to feel if you have a diastasis. So I do have one, but it's healed because I know how to protect it and close it. But if I don't engage, it's very much present. And so I can demonstrate that well, unfortunately. All right, plan for healing a DRA. I think every mom should have a plan because chances are you have one at your due date. And even if you're like, I don't want a diastasis, like you probably do. And can you protect it in postpartum? And then even if it's been years and you haven't healed it, it's never too late. A diastasis can improve at any time postpartum. So it's really about restoring the core from inside out. Deep breathing. I was talking to a neighbor on 4th of July who has a 5-year-old, is her youngest, and she was like, I had this horrible diastasis I never knew anything to do about. And then she came across Kundalini yoga and started doing breath of fire, which is where you do these forceful, quick exhales. And to do that, you need to engage your deep core. And she's like, doing breath of fire totally healed my diastasis. And I'm like, yes, this is what I don't think we see enough of in all these diastasis exercise programs is you really can heal your diastasis through breath. Just engaging your breath. And when can you start that? You can start it from day 1 postpartum. You can do it 5 years later and it can still make a difference. So deep breathing that includes deep abdominal activation. So I demonstrated this extended exhale breath. There's a video in the Facebook group. And pelvic bracing is another way. So through your day-to-day, are you exhaling, engaging the TA, lifting your pelvic floor through a Kegel, and then going through the task? Okay, consistent pressure management. Everything from week 2. Low before you go, and then we'll link it into common mama movements next week. And avoiding that bulge. So if you've seen, and not everyone with a diastasis has that, what they call kind of doming. So instead of when you're laying down, you're looking at your abs, they're like nicely rounded, like they're just kind of flat when you're not pregnant. And when you lift your head, some moms, not all, with diastasis will have this like center bulge. And then if you engage your deep core, it comes down a lot or completely. And so watching that when you're doing exercises, you're not seeing that bulge. And if you do, that means you don't have control. You're likely doing something that is too hard for your body at that time. And you need to look for an adaptation that's a little easier, so that you can maintain that integrity through the linea alba and the rectus abdominis. And the way you can maintain that integrity is from the deeper core being strong and supporting. Now, if you feel unstable through the core with movement, like you just feel like and this is more than initially postpartum. So by about 8, 12, up to 6 months postpartum, if you're still feeling like I feel really floppy, or like I have trouble just getting out of bed, or I'm doing dishes and then all of a sudden I just feel like I just can't hold myself up anymore, or I feel like my organs are coming out, or I feel like nauseous if I move too much. These are some phrases I've heard from moms who have very significant diastasis. I do encourage you to reach out to a pelvic floor therapist. I don't generally see, which I've never seen, a diastasis client that's sooner than 3 months postpartum, because I think there's so much that needs to be done with early on healing in those early days, that incorporating exercises and things like that is just not necessary yet. Let your body do what it can, and then let's dive deeper into it. All right, movements that help heal a DRA, diastasis rectus abdominis. So rotations are great. So these kind of movements are really good. Lateral, and then squats, lunges, warrior, goddess squats, all these different hip stability with the neutral hip alignment. What that does is to be able to do a goddess squat, which is this wide-legged squat, I need to be stable in my deep core. If I'm like flopping all over and not able to hold myself, um, I'm not strong enough in the deep core to even be doing this. So I need to make it more shallow. Now, when I have to make myself have to hold this, I'm indirectly improving the responsiveness of my deep core, which helps heal the diastasis. I hope that I didn't explain that all as well as I had hoped. But basically, those hip stability exercises indirectly build deep core strength, which helps the DRA. Okay, pelvic pain. So any pain in your pelvic region that has been present or reoccurring and is not linked to an infection. So infection is always important to rule out first. It needs to be addressed, and it needs to probably be addressed immediately in conjunction with a professional and you doing some things on your own at home. So I think pelvic pain should always be first assessed by a doctor. You should never be direct access to a pelvic floor therapist because we can't rule out infection. Only a doctor can do that. And that includes pain or discomfort with intercourse. We'll get into more the guidelines around that in the last week. Like obviously it's going to be painful for almost every woman the first couple of times having intercourse after giving birth. But in what time frame? And I'll give you more of those guidelines. But when we're talking about pain, a lot of you, when I say pain, you might be thinking of like a sharp pain, like a cut or just like a big like, ow, that really hurts. But pain has many different qualities, and pain in the pelvic floor is no different. So it could be dull, it could be tingly, it could be numb, it could be itching, it could be spasm, it could be like this weird pulsing, any kind of abnormal sensation coming from your pelvic floor, I would call pain or classify as pain. So not only including in your idea of what is pelvic pain as something that's sharp. There's many other qualities of pain, and it's actually those qualities that go ignored because women, people in general, don't think that's pain. They're like, oh, it's just itchy. Well, infection's been ruled out, so why the heck is it itchy all the time? You need to figure this out. And itching is kind of a more complex one to figure out if it's not infection, but tightness. And they're just like, oh, it just feels like tight, but isn't that good? Isn't my pelvic floor supposed to be tight? I'm like, no, it's supposed to be tight and flexible. So if you're feeling tightness all the time, you're not having the flexibility, and that's not optimal pelvic floor health. All right, so understanding pain. So acute pain is present for a short period of time. I think the best example for this is the perineal tear of like a first or second degree. It hurts. If it's a second degree, it probably has stitches, but it progressively gets better without any other intervention beyond the initial stitches or the initial, here's some lidocaine cream to put on it. And that helps it. And you're like, okay, it seems fine. It's getting better. No big deal. Not really what we're talking about here. Those issues usually don't result in the need for therapy. It's the chronic pain. Pain that has been present for greater than 4 weeks and is not consistently or progressively improving. So maybe it improves, but then comes back a month later. Or it kind of gets better and then it's just up and down day to day. It's very different, but over the course of the month, there's many days with pain. The earlier chronic pain is treated, absolutely the better the outcomes. That's why I say not ignoring pain symptoms and classifying pain symptoms much more broadly than you may have previously based off that last slide. Why? It's all about this nervous system sensitization. So nervous system sensitization is when you start to feel more pain for less of an impulse. So you prick your finger and you get like a paper cut and you're like, oh, that's like a 1 out of 10. Well, now if you have a sensitized nervous system, that paper cut might feel like a 4 out of 10. It's no different. The impulse to cause that pain has not changed, but your perception of it has gone up. It feels worse. We want to prevent that from happening, but the nervous system will start to adapt or become more sensitive to those signals. It's constantly being bombarded. Your brain is why you feel pain. It's getting this pain signal from your vulva every day. Ow, ow, ow. And over time, instead of it feeling like a 3, the same thing that causes it, maybe it's just a light touch on your vulva, is now a 6. Nothing about the quality of that light touch has changed, but it's hurting more. We want to avoid this, and that's why treatment early is important. And pelvic pain even more so, because I think people, men and women included in this, we're much more private about what's going on in our pelvic floor. And so you wait longer. You're like, oh, we'll get better. I don't want to go talk to my doctor about how it hurts when XYZ, whatever it might be. It's more embarrassing, or there's so many reasons around it, but it's no different than breaking your arm. You know, it's pain, it needs to be addressed early, it's better. Okay, so what can you do? I mean, I've said it already 100 times. This is one of those circumstances where I'm like, seek out treatment right away. If it's been present for a month, even 2 weeks, you could be seeking out treatment and starting to get that rolling. I don't think it really could be too early. And then relaxation. So pain puts you into this fight flight. That fight flight is a feeder of that sensitization. If you're more in your rest digest parasympathetic, your nervous system stays calmer, your perception of pain is lower, so helping prevent that sensitization, where you stay in your sympathetic, you're promoting sensitization. So things like deep breathing sounds so simple, and it is that simple, but it's that important. Time in nature, meditation, exercise, sitting with a cup of tea every night and just like decompressing. Massage, I suggest here, because it is a technique we use a lot, different manual touch techniques to help pelvic pain. So I'm not suggesting, what I am suggesting is that going to get just a regular massage, or having a massage therapist come to your home more regularly, can actually help pelvic pain, because it's going to help you relax. And when you relax, you don't feel pain as much, and your pelvic floor muscles relax, and it can be something that you can do without seeking out pelvic floor therapy. But if you do seek out pelvic floor therapy, there will be probably some manual touch related treatments that you're receiving. All right, I think I've answered this in like 101 ways. I'm gonna move forward to kind of my recommendations is just to follow your intuition. I gave you a lot of ideas of what you could do. And I think following that path of like, okay, I identify that something's wrong. I have an idea of what I should do. This is going to be my plan for this week. Okay, at the end of the week, I'm going to assess how did it go, and was that successful or not? And if you go through this 2 or 3 times and you're still ending with no success or no change, it's time to reach out for some more help. It may be that you just need to go onto a forum like my Women Maternal Wellness Facebook group and ask me a question. And I would be like, hey, you didn't try this yet, try that, and then let me know. Or you may actually need a screening or an evaluation. Your symptoms are occupying a lot of headspace. This is another scenario where even though you're going through this, if you're stressing about it a lot, it's causing anxiety, just like I was saying with the pain thing. I think it's good to seek out treatment earlier rather than running around ragged in the circle of not having success but trying things. Because when our headspace isn't in a good space, I think our ability to heal ourselves is not going to be as good. And having someone guide you through that process may be just what you need to get that success. So what you're doing may be exactly right, but because it's causing you so much worry, you may not be seeing the improvements. And having someone to hold your hand through the process or just give you some new outlook can be really helpful in getting, and it can be really quick. It can be like 2 sessions. I can think of a client where it was like 2 sessions. She just needed me to kind of boost her up, and it was more like coaching than therapy. But what she was doing was great, but she was really worrying about it. You don't know where to begin, or there are multiple things going on. So sometimes it can be kind of like, oh my God, I have like 8 things happening right now. All that Hillary talked about, I don't even know where to begin. So that's a more complex case. I think reaching out for support is helpful to kind of help identify what we need to do first, and help order the treatment. Or you're just like, I don't even know where to start. Like, this isn't something that was discussed. When in doubt, reach out for help and follow. If your gut's saying, I need support, reach out for support. And like I said, support can be from your doctor. It can be through my Women Maternal Wellness Facebook forum. It can be through personal email to me. It can be reaching out to a pelvic floor therapist. All right, so this week we have our group coaching session from 2 to 3:30. Come with questions. I'm going to try to keep the focus of this on the topics that we covered in the first 3 sessions. But I love, I'm going to start it with a meditation, and then I'm going to open the floor to your questions. Those are of priority to me. I would be great if you have some thoughts of what your questions are to send them to me ahead of time, because I might be able to pull some resources depending on what it is. But we can go on the fly as well. I'm going to talk a little bit about mindset if there's time, and coaching on how to integrate topics presented into your daily routines. My goal, as I've stated all along, is that you guys are understanding and being able to apply these concepts to your day-to-day, that like it's in your awareness. Okay, let's get it into like your tissues, that you just know what to do. You know you can just find pelvic neutral without thinking about it. And when you do think about it, you find yourself there. That's what I'm looking for, that you're able to achieve by the end of this course. So it's not just these education sessions and coaching sessions. There's work going on, or you're thinking about these things or doing something each and every day. So we'll kind of talk through strategies to get that happening. And if you have any of the symptoms discussed today, I suggest choosing one strategy. So say you have some leaking, set a goal. So I will keep a bladder diary for 3 days this week. And then after those 3 days, I'll analyze it and decide where to go from there. All right, I'm going to stop share. And I'm also going to stop recording. Thanks so much for tuning in, and I'll see you next week.